Yep.
And over to Tom. Tom joins us today to talk to us about ethics in leadership. I'll just quickly pop myself onto Spotlight as well. And he's going to introduce what might be a new concept for some of us, or something we may be familiar with if it's our background. It's the orange seventh hat. Very eluding. Tom, over to you.
The orange hat. Yes, I might just have a prop halfway through this presentation, but that's giving the game away, isn't it? Well, first of all, thank you to you, your colleagues, and John for arranging this, Jade. It is super appreciated to get the opportunity to speak to people because, you know, everybody's busy, and I genuinely appreciate your time if you've given your time to attend this session. I think events like this are incredibly useful, aren't they, for just pulling our thoughts together and helping us find our allies and coalesce around things and find themes and engage and network with other people. So without further ado, I have a presentation which I will now do a screen share, he said. So now you're probably looking at the notes page there, and what I need to do is just start that presentation off and then turn my display settings. Are you now looking at the presentation?
Are,
yeah. Fantastic, thank you. So this is this session. Now that's the picture, isn't it, that Jade and other people like to use of me. That's the lovely LinkedIn picture with a nice crisp clean white shirt. This is the one I like to use of myself, partly for reasons of humor. I couldn't do that with my hair anymore, and partly because I think it provides a fuller picture of who I am. We're all the sum of everything, aren't we? We're the sum of everything that we've been through in life. So who is this pale male still, well, apparently still middle-aged guy, and is he worth listening to? So I'm an author, I'm a consultant, I'm an educator, I'm a speaker, I'm a patient safety expert, a long-time justice campaigner, and a former NHS whistleblower. This is my contender for Grimmest CV of the year. Don't be alarmed by my dark humour. My dark humour has got me through many a low day. It's how I deal with many of the things that I've been through. And I'm showing this to you to make a point about the passage of time, because I think sometimes we suffer from the illusion that things have improved over time, that what happened then could never happen now. And so we feel kind of okay about that. We must be moving in the right direction. It's my belief that healthcare organisations are now more reputationally defensive than they have ever been. I'm not saying it's a good thing or a bad thing. I think there are forces that have driven them to be that way. It's become highly politicised, but it is, so as well as being an entirely understandable thing, it can be problematic. When life gives you lemons, that's probably the best explanation of this slide. Some of you will have seen these books, perhaps even read them. If you haven't, my shameless plug today would be have a look on Amazon, and it would be great to buy a copy and give me a review. Because of the experiences that I've had over the years, I'd get invited to contribute to various reports and pieces of work, and I've just listed some of those on for you here. Of course, the two most recent being the Thirlwall inquiry and the parliamentary inquiry into NHS leadership performance and patient safety. Many of you will be aware of all these well-publicised recent events and the ongoing inquiries into them. We've all seen the various documentaries, haven't we, and picked up the papers. No organisation is immune. So this is good news and bad news, isn't it? It's not just the public sector that suffers with these things. It's not just the NHS that suffers with these things. In all of the cases that you've seen there, and in the cases that you're looking at on screen now, so Cork Bank, VW, Oxfam, it's not for the lack of published values that these things happened. It's not because those organisations didn't have a set of values or a set of ethics or a set of accepted behaviours, but they were laminated rather than lived. I pinched that phrase from somebody else, by the way. And those, all the bodies that we're talking about here, you know, they thought that their values existed because they were printed, but values only exist, ethics only exist when they are lived. Some of you may be familiar with this. This is Edward de Bono's famous and incredibly useful 6 hats thinking tool. The reason this is incredibly useful, and so many people have found it to be extremely useful, is that it encourages people to look at things through different lenses in a non-judgmental way. So imagine the setting. We're all sat around at a meeting, and you've got those people there, haven't you? We can all name them. We can all see them in our heads, can't we? There's the person there that's generally the critic. There's the person there who thinks everyone's lovely. and there's everything in between. There's the pedant or the nitpicker. There's, you know, the person with a high level view. You know, what this does, what tools like this do, and what De Bono's 6 hats do brilliantly, and he's got one called six shapes. I think there's another one as well called 6 thinking tools. It allows you to say, right, okay, let's all put on the yellow hat. Let's all put on the green hat. Let's all put on the black hat, the red hat, the white hat, or the blue hat. And let's think of what we might say if we were looking at the world through that particular lens at that point in time. And what that does is it allows people to say the things that they might not have felt able to say because they might have been labeled as either negative or overly positive or overly optimistic. It allows them to look at things and just air those thoughts in a non-judgmental fashion. Can't overstate the value of that. It's a really, really brilliant thinking tool. It is good to see things from a different perspective, and hearing Lisa talk about understanding the importance of the patient perspective, the service user perspective, the perspective of other stakeholders within the system. You really have to understand them and see things from, live in their shoes, if you like, and see things from their point of view. If you're going to gain that all important thing, again, that Lisa mentioned, which was trust. Trust is so underrated in terms of its importance within both organizations and teams and at the individual level. So seeing things from a different perspective is a good thing. But I think the most important hat is missing. And here comes my prop. I'm not sure if you can see me much on screen there. I think especially in public services and especially in health and care services, I think we need to supplement all those other hats with the orange hat of ethics. Because none of those previous hats that you saw there, they touch upon principles. If you read Edward de Bono's work, and he's a very nice man, I have to say, before he passed away, he replied to some of my emails, and I've been in correspondence with his son, Casper. What those hats don't do is specifically say, right, what's the ethical dimension to this decision? And I'm going to bring this to life by telling you a very short story about a meeting that I attended. I joined the NHS in 2012. Not long after I joined the NHS, I was invited to attend a meeting of fairly senior folks who were overseeing mental health services in West Cumbria. And the situation I found myself in was I was fairly uninformed. I was a bit of a bystander at the meeting, if I'm, being brutally honest. And I was keen not to upset anybody. So I didn't want to say the wrong things. I wanted to fit in. I wanted to gain the respect of my, new colleagues, most of whom were senior to me. And one of the conversations that went around the table was that the service needed to save money. The service had been told by the centre that it needed to save money. Now, there was a problem with mental health capacity in West Cumbria at that point in time, and I'm going to touch more on that in a moment. But what was done, the decision that was made, was that the trust would decide that it shouldn't advertise the vacant posts that it had, of which it had many vacant posts, which would allow them to come in on budget. So they're getting pressure from the centre to come in on budget. The costs, as we all know, the costs of hiring people, employing people is the largest cost within the NHS. So what better way to come in on budget than not to employ the people you need to deliver the services that you're supposed to be delivering? And when I look back on how that decision was made, I realise now that nobody raised the point about where was the ethical dimension in that. And when I think we should apply the orange hat is when we are involved in decision making. I'm not talking about the kind of decision making where we used to call it limited problem solving when I was in the world of marketing. That sort of limited problem solving where we're saying, we need to change the printer, or we need to buy a different type of paper from somewhere, or we need to change the desks or the carpets. The sorts of decisions that have impact, the sorts of decisions that will affect the stakeholders within the system, that's when we really need to be conscious of applying that orange hat. When people make choices, they have consequences. And going back to that meeting that I was present at in West Cumbria, looking back on that and seeing that what essentially had happened was a group of intelligent people had decided to do something that I would think was pretty unethical. I am ashamed of myself for being part of that meeting. I'm going to be honest with you. There are lots of excuses I could use. I was new to the trust. I was new to the NHS, blah, blah, blah. The truth is that I was too worried about gaining and maintaining the respect of those senior people in the room around me. So choices have consequences. And here's what happened in West Cumbria afterwards. West Cumbria now has one of the highest suicide and severe rates of mental health illness in the country. In fact, I think in the UK, it had the highest rate of suicide. And I can't help thinking, I wonder if the people in that room at that time, while we were all sat around there making decisions about reducing, essentially what we were doing was saying, let's reduce the capacity in the area. If they'd put themselves in the position of families and loved ones and friends, I can't help thinking that they might have made a different decision. If they'd said, well, how, ethically, if a service user was me, a member of my family, or somebody that I loved, somebody that I cared about, would I want us to make this decision? And I think part of the problem with, if I can say this, certainly with NHS management, is that it's often detached from the consequences of the decisions that it makes. And then that shows up and everything goes to hell on a handcart. And we look back and we go, well, how did that happen? And, there's a lovely phrase, which I think Peter Senge, some of you might have read Peter Senge's work. He says, we are where we are because of decisions taken previously, sometimes unconsciously, sometimes decisions not taken. But a decision not taken is still a decision not to make a decision. So we are where we are at any one time in our lives and in the organizations that we are in because of decisions made previously. I think that's something worth bearing in mind when we are making decisions. The Orange Hat engages our humanity. So even though De Bono's hats, the red hat talks about feelings and emotions, I'm talking about specifically using a hat that engages our humanity and says, as people, it's more than merely demonstrating integrity in decision making. I think supplementing six hats thinking with the orange hat of ethics ensures that the ethical dimensions in any situation are acknowledged, alluded to, and not missed or ignored. I think the use of the orange hat in all the decision making that occurred in every one of those organizations, public, private, and voluntary, that I referred to earlier, I think it could have had a huge and significant impact on the choices that were made and not made. Some of you will have come across the concept of the empty chair. I think this is a brilliant tool, I think, and it was made famous by its apparent use within Amazon. So the idea was that when you're having a business meeting within Amazon, the directive from the top is that you have an empty chair or a metaphorical empty chair in that room. And the empty chair represents the consumer, the customer, the service user. What is what you're doing? What impact is what you're doing would have on them? What's the impact it would have on them? Would it have any impact? Does it matter to them? So I think, in short, when you're meeting, when you're discussing, when you're thinking, imagine the consumer is present and ask if what you're doing will have any impact or mean anything to them. And if you want to really bring this to life, imagine it's your gran or someone that you love who's sat in that empty chair. Imagine them as the person who the change that you're thinking about might impact upon. Bring that to life. What would you do if your gran was sat there in that meeting room in that chair? So I run a short course which can be delivered online or in person, and I'm very pleased to say that the Institute, thank you Jade, has asked me to deliver a series of leadership masterclasses for members which commence in late November. And during those, I will be looking at the orange hat and how to use it in more depth. So for me, that is thank you, sincere thank you for your time and attention. And I will now stop sharing my screen. And if anybody has any questions about the orange hat, we shall.
Just before we hand over to questions, you have mentioned the workshop series. It's an 8-part series. I'll pop a link in the chat box that's got a brochure that outlines all 8 sessions in that series. Tom and I would love to see you there. He does do a deeper dive into the Orange 7th Hat and many more areas around ethical leadership, compassionate care, and safe compassionate care as that as well. Have we got any questions today from our audience? Feel free to unmute, shout out, I'll find you, or you can pop your virtual hand up or use the chat box.
Can I come in? I'm not sure how to.
Of course you
sorry,
can.
I'm not sure how to raise my hand.
That's fine, and then we'll hear from Aidan.
But anyway, thanks for that, Tom. That was really fascinating. I'm just reflecting that. Ethical consult. I'm aware. Some years ago, I was working in a hospital context, and I remember that there was this almost like a service, an in-house service, where a clinician could request formally an ethical consult. And I'm also aware that Great Ormond Street, for instance, has a clinical ethics service. So anyway, so my question is that prevalent? And if so, how does that work with your suggestion that at times people should put the orange ethical hat on?
I think they are separate things. I think I'm talking about you will at any one point in any NHS trust across the country, and so collectively at any one point there'll be hundreds of meetings happening, yeah. And a lot of those meetings right now, let's be candid, they're talking about costs. You know, they're talking about how to do more for less. And unfortunately, some of those conversations then get fixated on doing less while still meeting the KPIs, yeah. So I think I'm not just talking about applying an orange hat in clinical meetings or having an ethical consult. I'm talking about when we have those meetings where decisions are being made and we're using tools such as the 6 thinking hats, which many organizations, by the way, many teams still are unaware of the value of using those sorts of things to shape their thinking and to look at situations differently. I'm saying that those managers, those teams need to apply an ethical hat to their thinking and say, well, what are the ethical impacts of this? If we cut costs here, what does that mean? And in the situation that I referred to, where there was a mix of clinicians, there was a mix of managers from all different levels, yeah, I think asking that question, what's the ethical impact of this decision? What are the ethics behind this decision? I think we might have reached a different conclusion. So it's having a particular lens to pick up at any one point and say, let's just look at this through the ethical lens before we do anything more. Does that make sense?
It does. I mean, sorry if I could just come back. I thought you were almost advocating the non-clinical or the managerial equivalent of a clinical ethical consult, and advocating for the need of such the importance of such a service, and having that managers should have more and perhaps more systematic, more ethical considerations of decision.
Because the issue is, it's not that people are bad people. And I think we're all familiar with the phrase that nobody turns up to do a bad job. I think we all get that. What happens is, though, you've got groupthink and you have seniority and you have people deferring to other people in meetings who are. So if the most senior person in the room steps forward with the idea that costs need to be cut regardless, then essentially everything that flows from there, if the hierarchy is strong, is based on that premise. And there's a huge cultural shift here. But the benefit of the hat is that it allows you to speak to seniority and to speak truth to power without it being seen as challenging. Because, I know from experience that the NHS doesn't welcome challenge to any great degree at all. So actually saying, have we, board meetings, management meetings, have we looked at this decision through an ethical lens, and what are the implications of it? And those implications might actually, when we were talking earlier about ICSs and Lisa was talking about how to coordinate things, is it ethical, for example, for public service bodies who are publicly funded to place more workload onto the third sector? Don't know. But have they even considered the ethical perspective of that? I don't know. Your work with IT is, has got massive ethical implications, not in the traditional sense with things like data protection and security breaches, etc. But actually, if what we're saying is we're going to withhold technology from our service users, yeah, we're going to reduce access to services. So in a place like Cumbria, technology is the enabler that allows people to access many services. If you make a decision not to apply a piece of technology that would help people access services, there's an ethical dimension to that decision.
When it's evidence-based.
Thank you, David. Aidan, over to you.
Okay, thank you, Tom. I mean, that was very thought-provoking. And I've been in those rooms many times, so maybe should apologise more than you've apologised. However, I suppose the conundrum for me is what is the ethical option? There is a scarce resource. The world has scarce resources. The NHS, social care have scarce resources. And, the taxpayer is not prepared to pay more for these services. because I would suspect that the people in that room in West Cumbria probably did, even if at a very personal level, they probably did apply some kind of ethical process where they felt what is the least sort of damaging thing that they could do. And perhaps, it may have been helpful if, we were able to say, well, actually, out of the options they picked, these were the other options. Because, I honestly do think that most senior people in these positions working in healthcare and social care and so on are aware of the potential implications, and that when they are considering these things, they are trying to do the thing that they think is going to be the least damaging. Because we can't just say, well, we'll just carry on spending and spending and spending. That itself is not an option. So, I don't know. It would just be your thoughts really about what potentially are the other options and that kind of thing. And in a world of scarce resources, how does that ethical dimension play out?
Well, that's a great point. So I remember being a school governor, and don't ask me how that happened. I ended up as deputy chair, and at one point chair of the school governors. I don't even have kids, Aidan. I think I was just seen as a safe pair of hands. And we were constantly being told by the Education Authority to cut spend on this and cut spend on that. And I think my take on it was very different, actually. Let's find ways of doing what needs to be done. And if that means the only option left is to overspend, and the only thing that's going to happen to us is we're going to get shouted at by the Education Authority, then I'd rather get shouted at by the Education Authority than let the children come into the school suffer because they're not getting what they need and what other schools are able to give them. And I guess what I would say is there's an element of challenge here that's missing, isn't it? Because we assume, and forgive me for if I've got this wrong, but underlying your statement is an assumption about hierarchy, that it comes down, that we have to make these choices. And my great issue with leadership within the healthcare service is that actually, to be a leader, you need to challenge back up. Leadership isn't simply about telling people what needs to be done because somebody else told you that needed to be done. Leadership is actually turning around and saying, hang on a second, this is going to have an impact. I don't agree with what's happening here. Now, it's a good point you make. Did they consider other options? The answer is nobody actually said, we need to turn back around to the centre and say, I'm sorry, but this can't be done here. Are there other areas that they need to look at in terms of cost? The problem was, Aidan, that there was a huge amount of fear within that trust because the centre didn't receive bad news well. So if you went back to the centre and challenged, the messenger got shot. And I think that was the prevailing culture. So that people's choices and their thinking was influenced by that culture. Nobody felt it was within their power to turn back around to the centre and say, this is a really bad thing that you're asking us to do because you're forcing us into a corner where the only way to save money in the way that you want us to save money and the amounts that you need us to save is to cut capacity. And that's that kind of honest adult to adult conversation that is often missing, I think, in the NHS. Does that make sense?
Oh, it makes absolute sense. But I think that, one of the earlier discussions in the conference day was about the differences and, the difficulties within ICSs that, there's this statutory responsibility to balance books for local authorities. And the local authorities, sit there and say, you in the NHS, you just seem to spend what you like and, you run up these big deficits. And in fact, most NHS organisations do have huge deficits, most of them, because of exactly this problem of making these kinds of decisions. But at some point, there is a limit because, the reality of what happens is, and I do think people do challenge, I've been there when people have challenged the centre a lot on some of these things, is at the end of the day, those people disappear and they're replaced by a bunch of people who eventually will do as the centre requires. So, or, like many of us, you leave the NHS because, those ethical problems of got to such a level where you just feel you can no longer be part of it. Well, even the danger with that is that most of us who work in the NHS love the NHS. We love what it stands for. We love how it changes people's lives. So you're always in this dilemma of you want to be there because you think if I leave it in the hands of other people, they may not care as much as I care or the people I work with care. So you know, it's a it's a very complex problem. I don't say there's any answer.
Can I just cut in there, because I know that this is an absolute conversation that could go on all afternoon. I think we feel very strongly about this, and it does feel quite emotional sometimes as well, because there's very different opposing parts and paths to that. But it's great to have these open discussions, and that's what's so important, that we continue to talk about it and we continue to see each other's perspectives. Now, I know, Tom, if anybody, I'm sorry, Andrew, we're not being able to come to you, but if you want to put the question into the chat, we will make sure that Tom gets back to you, if that's okay. But I'm very conscious that we are a little bit behind now.